Hello, everyone. My name is Victor Gonzalez. I'm the Senior Director of Patient Services and Patient Programs and Support Services at the Lymphoma Research Foundation. This is the Nutrition and Food as Medicine session, and it's my pleasure to introduce our speaker, Peter Adintori. Peter is a clinical research dietitian at Memorial Sloan Kettering with a background in nutrition and exercise physiology. Thank you so much for being here, Peter. I'll hand over the program to you.
All right. I'm always excited when this session comes after lunch and not before lunch, because talking about food to a bunch of hungry people is never a fun thing. And so I hope everybody enjoyed lunch and is not too tired in the post-lunch slump. So I am very grateful to be here to speak with you all today and give you my take on really the role of nutrition while going through cancer treatment and also afterward. So let's see if this, there we go. Okay, so here's roughly what I'll speak about today. So I want to start by talking a little bit about what makes up a dietary pattern, really also focus a little bit on nourishing yourself or loved ones during cancer treatment, and also connect dietary patterns to both risk reduction for cancer, especially secondary cancers, after completion of treatment for lymphoma, if that is relevant. Also going to debunk a couple diet and cancer myths, and probably I can't get through all of them in an hour, but I'm more than happy to discuss any of them in more detail, and then just summarize with some key takeaways. And I have included my disclosures here, none of which really impact the content of this presentation, just some consulting that I do related to nutrition and cancer care and beyond. So starting off by really constructing a dietary pattern, I've sort of broken this down into a few components. So when we think about how we decide what exactly we're going to eat in a given day, there are some things that potentially rumble through our minds. So the first is, of course, how do I blend how many carbohydrates, proteins, fats do I have in my diet? Where do those things come from? Should I be choosing animal foods, plant-based foods, healthy fats, less healthful fats? Does it really matter? In cancer, we often get questions around, should I be following a low-carb diet, ketogenic diet, these sorts of things. And generally, what I usually share with folks is, when we're thinking about macronutrient balance, the most important macronutrient here for a lot of folks is protein. Because protein during cancer treatment is really important to help keep your muscles, bones, and body nice and strong while you're enduring treatment. And really the takeaway from this is to have a portion of protein every, say, 4 or so hours throughout the day. And so that seems intimidating, especially when symptoms happen. But really the takeaway here can be that if you're having a meal or a snack, try to incorporate some source of protein into it to really keep that body nice and strong throughout the day. So that's usually the sort of snippet that I give to patients when it comes to macronutrients. Similarly, there's a lot of talk these days about, should I be more plant-based? Should I be including more animal products in my diet? What does that look like? So this is a very wide spectrum here between all the way of someone who follows a vegan diet, which has no animal products at all the way to somebody that is carnivorous and only eats animal products, which is not usually what we see in America. We usually see a pretty blended diet here. And you can see there's quite a spectrum here. And so what I encourage folks to typically think about here is, where can you incorporate more plant-based foods into your diet overall, ideally coming from lower processed food. So it doesn't mean that you have to swap all of your beef burgers with the various Beyond Meat burgers and all those other types of burgers that are out there, right? That's a little bit of a more processed choice, but it's really to see, okay, where can I incorporate more plant-based items into my diet, right? And that's why I've sort of included this as a spectrum, and you'll see on the next slide I've taken a similar approach, because it's not an all or nothing type thing, when it comes to following a dietary pattern. A lot of the things that happen with diet happen over time, right? So incorporating one more plant-based food into your diet overall throughout a week, overall throughout a couple days, can really make a big impact, right? So these things are about creating habits and creating routines that really support overall health. And following a diet that has more plant-based foods in it is generally helpful for a variety of chronic diseases, cancer being one of them. Also similar with diabetes, heart disease, kidney disease, a lot of the others as well. There can be a lot of benefits to including more plant-based foods into your diet. So similarly, this is another idea here of the degree of food processing. And now you've probably heard that very ultra-processed foods are not so great for our health. We unfortunately consume a lot of them in the US. That's sort of one of the major reasons we think that over the past few decades, there's been quite an increase in the average weight of our population of folks in the US. And similarly to plant-based foods, I always take the approach that this is a spectrum, right? So it's not to say it's either a whole food or not, but to say, is there a way to incorporate more whole foods into your diet and try to eliminate or limit the amount of processed or ultra-processed foods. So that could be, increasing the amount of home cooking that's happening, which of course is challenging. So what I work on with a lot of my patients is either how do we make cooking at home a little bit easier or a little bit more accessible to folks in order to really help eliminate how much of the sort of outside foods are happening, especially during cancer treatment when those foods may be including a lot of saturated fats and things that are not always the best for us, but can be helpful when we're having a hard time with maintaining our weight. And I'll talk about the nuance there in a moment. But similar to the plant-based foods, incorporating more foods from this unprocessed or minimally processed category, group 1, is good, which I think this graphic, I have a couple of snafus with this graphic that the red category is the good one and the green one is the bad one, which is sort of, not bad, but is the less favorable one. It should really be flipped just for ease of understanding, but this is, again, just sort of a thought process that one has as they're constructing their dietary pattern. And I'll share this slide again at the end as my takeaway slide, but just to give you sort of the overall perspective that a lot of dietitians have, myself included, is that the dietary pattern that works best is the one that works best for you, right? There's no perfect formula for if I could give everyone a prescription here for a diet, here's what it would be, right? Because that diet has to be something that works for people, and it's something you can do for 5 years, 10 years, 20 years, however long, right? If you tell me, yes, Peter, I can follow this diet for 5 years, that's great, but what happens the year after that, right? And this is the major reason that many dietary patterns fail is because people are not given the strategies and the tools to really keep this as part of their routine long term. And so what I really share is these 4 tenets that come up with dietary patterns is finding that balance, right? There's one of the faculty at NYU where I'm doing my PhD right now has a really fun sign outside of her door that says balance is a cookie in each hand, which I really appreciate. And the reality is balance looks different for everyone, right? Some people have a sweet tooth, some people like salty foods, crispy foods, things like that. And finding that balance is really important because eating should be something that feels like it's sustainable for a very long time, right? So finding that balance is important and having someone to bounce those ideas off of, whether it be a caregiver, a clinician, dietitian if you have the chance to see one, and being able to find that balance with the help of someone else can be really valuable, especially as that idea of eating changes throughout the course of cancer treatment. Also, I am a big fan of what we call gentle nutrition, which is just giving yourself grace, right? It's really difficult to stay nourished, and food can be something that induces a lot of anxiety in people. And so really giving yourself that space to be gentle and have grace with yourself can be really useful in finding the best way to nourish your body. And also here is being consistent as much as possible with your patterns, so not having significant fluctuations where, I have many patients over the years who eat a certain way during the week, and then as soon as Saturday turns on, it's an entirely different person. And that's a challenging thing for your body to endure, that there's sort of 2 different people living inside of your body where, maybe during the 9 to 5, work week, it's one thing, and then the weekend, sort of the wheels fall off the cart, if you will, and then your body is sort of really challenged by that. So I encourage folks to be fairly consistent as much as possible and allowing yourself that grace and flexibility throughout the entirety of the week. And then also, of course, something that's personalized. So that's not only personalized to your own nutritional needs during treatment, but also to your cultural needs, your level of cooking experience, the access to food that you have, there is no perfect way to achieve this. And so the best way that you can really find this balance is to personalize it to you, right? Your tastes, your preferences, things like that. And it's something I really value working with patients is figuring out what that looks like, right? Because there is no perfect formula, it can really help massage what a dietary pattern looks like for each individual patient in their own circumstances. And it's something that I think is really powerful working with a dietitian while you're going through treatment and beyond. And so in the bottom left, you'll see probably the one thing all of my patients say is really valuable is to take life one meal at a time. Just because breakfast goes really well or doesn't happen at all, doesn't mean the day is ruined, right? Or the day is going to be perfect, right? So really saying, okay, I'm stressed because I haven't eaten enough today, but I feel really nauseous or I feel really tired or whatever is going on, just sort of thinking through to the next chance to eat something, whether it be a snack or a meal, and saying, okay, I'm going to take it this meal at a time, and then we'll worry about the next meal once it gets there, right? It's a little bit more achievable to think of life that way. And that is also similar when you're going through finding this balance, is to say, just because I know I'm going to have a large meal later doesn't mean I need to restrict myself now, right? To really take those meals one step at a time. I always give the example of when I was in college and I would go to all-you-can-eat sushi at some point and then wouldn't really eat during the day so I could really get my money's worth, and then you feel really ill after that. So the ideal is to not necessarily affect your eating patterns based on what's coming up or what has just gone on. And I will also just put a plug in here for the American College of Lifestyle Medicine has really developed this domains of health, if you will. And it's really something that I think is important, and I emphasize with my patients every time I speak to them, is that diet is just one tool in your toolbox, right? It's not the only thing that matters. So moving your body, creating healthful relationships, managing your stress, getting your sleep into a good place are all opportunities for engaging in health. And to recognize that is really useful, because my patients may come to me and say, Peter, I'm having a really, really hard time eating. And I'll say, great, that's part of the process. Tell me what else is going on. And they'll say, well, I'm sleeping really well, and I'm moving every day, I'm going for walks. And then I really help them find space to celebrate those things, right? Because when we're going through treatment, there's only so much we can control, and food is not the only thing, right? So there's so many opportunities here to make healthful choices and to have engagement in health. And it's to de-emphasize that food is the only option. And so this is something I really hold close to my heart, because eating is not always easy, and it's very easy to feel like you're losing a lot of control when eating becomes challenging. So really trying to think about that big picture and see where there are opportunities to engage in health can be really valuable all throughout the process with cancer. Okay, so now to focus a little bit on nutrition during cancer treatment itself. There's really these 4 goals that many folks have. I would say a lot of people focus on the first 3, and I also really, really focus on the 4th one, which we'll address in order here. So overall, to try to minimize the amount of weight loss that we have throughout the treatment process, to practice good food safety overall, which is good for all of us, especially important while going through treatment, managing symptoms that may happen or may not happen, and then also protecting your relationship with food and your body overall throughout treatment. So with minimizing weight loss, this is something that happens commonly going through treatment, is that weight loss may be a reality for folks. And this can happen because your appetite might change, food may taste different, smell different, you may have some experiences with sensory changes, you may have symptoms within your gut that cause your stools to be a little bit weird, whether they be less frequent, more frequent, a little bit more loose than you're used to. You may have some gas and cramping and things that just feel abnormal, and it makes it really odd and really challenging to eat. There also may be general fatigue and low energy, and also stress and changes in mental health that happen just by the nature of cancer being an extremely stressful thing to go through. And so what I always recommend for folks is to, again, this is where the one meal at a time can be really valuable, because it is important to not let the experience of one meal really bleed down into another meal and kind of become a challenging pattern. So some of the major tips I have, and I'll bring this through as a thread throughout the rest of the talk, is to really make sure that you're given some actionable tips with each of these things. So when you're having challenges with your weight coming down, something you'll hear a lot is small, frequent meals, which what does that really mean? It doesn't really have a really hard and fast meaning. What I would say is that a meal doesn't have to be a huge, regular meal that you're used to having. If your meal has some source of protein in it and some source of fiber, those are really great things to include throughout your diet. And a variety of foods can always be valuable, right? I've done a lot of research on the gut microbiome, which is the bacteria inside of your gut, and those bacteria love a variety of foods. So fruits, vegetables, whole grains, if you can. And in times when you're not having a lot of variety in foods because of symptoms, really focusing on those higher calorie and higher protein foods will really keep that healthy weight on and keep your body in a state where it can be the most strong and the most successful going through treatment. This is also where I think about reframing the idea of healthfulness, right? So I think when we hear the diagnosis of cancer, there's a really strong desire to eat only healthy food, right? And we know healthy food. I always, joke with my patients that everybody in the world knows that a salad is healthy and that a burger and fries is not, right? That's just colloquial understanding of nutrition. However, if we only eat really healthy food, so you eat salads for every meal, that's not getting you very far with calories, right? So when you're having a hard time keeping your weight on, really leaning just into foods that are lower calorie is really challenging to keep that weight on because your body's working really hard to treat this cancer. And so in the grand scheme of things, you may end up incorporating foods that are maybe not the most healthful for you long term, but this is temporary while we endure treatment to really keep your body as strong as possible throughout that treatment process. And there are many ways to achieve that. I will say a lot of folks end up leaning on smoothies, milkshakes, ice cream, things like that. And these can be things that are a little bit easier to tolerate during the treatment process. I'm a big fan of custom-made smoothies that can be changed around with their ingredients to really make them enjoyable, depending on what's going on with your taste, and also what ingredients you're tolerating at that point, because they can be really flexible and you can pack in a lot of nutrition into a smoothie. And sometimes it's just easier to sip on something than it is to sit down and have a whole meal, right? So that can be something that is a really useful tool for folks going through treatment, especially when you may be a little bit more sensitive to the classic Ensures and Boosts that are like very sweet and are usually chocolate, vanilla, strawberry flavored, and that's not always the flavor everybody wants, right? I will say my patients always look at me funny when I say, do you want an ice cream? And then I'll bring them a little 220 calorie Haagen-Dazs ice cream, and they're like, it feels weird the dietitian's bringing me ice cream, but trust me, there's a time and place for it, and usually going through treatment is that time to really embrace the variety of foods that maybe aren't the most healthful. And in that moment, what's really important is to talk through what's going through your mind, right? You should never feel like you have to navigate the world of nutrition during treatment alone, because I can tell you there's so much information out there about everyone's sort of idea of what's the most healthful. And my hope today is that you'll leave with a little bit more of a nuanced view of what nutrition looks like during treatment. Okay, and we talked about gentleness, and then I would just say move your body as able, right? We know the sort of age-old adage of a body in motion stays in motion, but treatment can be really tough on our bodies. And so really trying to move your body a little bit once per day as much as possible is good, but also to listen to those cues, right? So when you're feeling really tired, you just had treatment, something's happening, listen to your body and be gentle, right? Take that space, because sometimes it will take a little longer for your body to recover than you were used to. And so taking that space to recover is important, but keeping that body in motion is also really valuable to really continue to approach that healing process. So another one is food safety, and this has come up a lot over the years in treatment for blood cancers more broadly, is that over the years, we used to think that people would have to follow a sterile diet or a neutropenic diet, and all of these restrictions were placed. And over the last, say, 10, 15 years, we've really developed an understanding that all that is necessary to do is to just practice good food safety. If you want some specific resources on that, all of our patient education materials at Memorial Sloan Kettering are open access. So if you just Google Memorial Sloan Kettering Cancer Center food safety, you'll see the couple of handouts that I've written over the years and a couple of interviews I've done for the hospital for this purpose. And what I will say is the major things are to make sure that your meats and proteins are cooked thoroughly It doesn't mean that you have to cook them to the point where it's like a hockey puck that you're trying to eat, but cooking them thoroughly enough to reach the correct internal temperature for safety is important, right? Making sure that all the dairy that you're getting is pasteurized, ideally not having, raw milk, raw types of food when you're getting them at the farmer's market. And also just making sure that when foods are meant to be hot, they're maintained at hot temperatures, and when foods are meant to be cold, they stay cold. And so there's much more detail about this, again, in the handouts that I've written, and then also the Food and Drug Administration, or FDA, has a lot of really great resources as well around this topic. And one thing I think that is important to note here is that specifically with leftovers, whether it is that you're cooking something or you're getting a takeout food, which I know is always a little bit anxiety-inducing for folks that are worried about food safety, is to really keep those leftovers for a maximum of 2 days, which sounds crazy to a lot of people. But especially now that we're getting into the cooler months, I always give example of soup, right? Because who can get through a pot of soup in 2 days? Not many people, especially when your appetite is lower. And so what I recommend for things that are larger batch prepped, to really prep or to freeze individual portions to then take out sort of the night before you may try to have it the next day. Because then it's fine. The freezing really sort of pauses that 2 days and gives you a new 2 days coming over. And the best thing when it comes to leftovers, things like that, is to just really take out the portion that you will likely eat or your loved one will likely eat, because it's much easier to just heat up a little bit more rather than try to heat up some and then doesn't get eaten and then try to cool it back down and then heat it up again. That sort of is a dangerous practice to have, increasing the risk of food poisoning, which we certainly want to avoid. And when it comes to food safety, the reality is that it's likely not the end of the world if you do get foodborne illness. It will just be a lot harder for you to recover from this foodborne illness, where for myself, I'd probably be in the bathroom for a few days and be really uncomfortable, whereas other folks that are going through treatment may take a longer time to recover, and it could lead to more complications. So the goal is to really give yourself the best chance possible of avoiding food poisoning, and then there's many more resources here to talk through this, and I'm happy to answer specific questions as they arise about food safety particularly. So there are many symptoms that can and cannot come up during treatment. What I'll draw your attention to is at the very bottom I have this qualifier that symptoms are personal to your experience. So just because you might experience nausea, you might experience loss of appetite, you might experience some throat pain or some pain in your mouth or food that might taste different, doesn't mean that you're going to, right? And the way that each person experiences these things is unique to them. So the way that one patient may describe their nausea may be very different than someone else. And someone's tolerance for these things may be very different than another person. So the most important thing here is to be able to have space to talk through what symptoms are going on, and then have clinical team members that can really help navigate these things with you. One of the things that I think is important here, and I believe I have a summary slide and a couple slides where I also mention this, is for things like nausea and vomiting, diarrhea, bloating, even dry mouth, things like that, there are additional medications that can be provided by the clinical team to help manage these conditions. I always encourage my patients to not try to be a hero during the process and fight through nausea, fight through diarrhea, fight through these things and just say it's part of the process, but to really advocate for yourself and say, I'm not really feeling comfortable, or I'm nervous that I'm going to be nauseous. Is there anything I can take preventively to really treat that? It's a really important thing to use those medications in that time when eating is the most challenging to really give you the most success going forward. Because that really challenging period may only last for a couple of weeks, but what you're able to actually do and maintain with your body function during that time can be really valuable going forward, depending on whatever treatment is necessary going forward. And something that I always mention to patients going through treatment is the things you're able to achieve during your treatment, whether it be maintaining your weight, keeping your intake pretty good, keeping your body moving, will allow you to have more treatment options should you need to continue treatment going forward, right? The patient or the doctors and folks will feel more confident giving you a stronger treatment going forward if you show that you're strong enough to receive that, right? That's always the balance we take in treating cancer, is how well is this person going to tolerate the treatment? And likely if someone is in a stronger body, they're feeling well, they're doing well, I personally, if I were the one making that call, and I thankfully am not the one making that call, would feel more comfortable giving a stronger treatment to someone that could be a little bit more fit to receive that, right? So give yourself the best chance possible to endure the treatment that you will need. So I've broken these treatments or these symptoms up into 3 categories here. Essentially, symptoms that make it hard to eat enough, so where you could eat, but getting to the point where you're meeting your nutritional needs can be challenging. Symptoms where it makes it really challenging to eat anything because you are nervous about being nauseous, about having more diarrhea, about what's causing you to be constipated or bloated. These are not comfortable things to experience. And then things that may really affect the eating process, right? Things like food tasting differently, your mouth feeling dry, feeling sad, feeling fearful about food, right? These can make things really challenging and make you not want to eat. And so here are some tips that I would like to share. And I'll just share a couple on here, that way I'm not sort of reading at you. With low and no appetite, one of the things is just make eating as easy as possible, right? So these can be smaller meals, separating your liquids from your meals so that way you're not filling up on some sort of fluid. It also could be actually using your liquids to be your calories. So those could be nutrition supplements, smoothies, beverages that have calories in them like juices, things like that, because those sort of allow for each sip to be something that you are actually getting calories in. And I can give you the example. I see a lot of patients who are going through bone marrow transplants. And in that period, it becomes that they are taking a lot of medications orally. And you may have a similar experience where there's just a lot of medications on your list to get through in a day. So a really simple thing I encourage folks is, instead of taking those with water every time, why don't you take them with either a spoonful of applesauce or a spoonful of yogurt or beverage with calories, because then every single medication you get some nutrition with it as well. And that can be a really simple but really easy way to say, okay, how do I sneak some more calories in, right? So it doesn't have to be these structured meals where you're able to get some more nutrition in. It can be incorporated throughout the day. Similarly, what's really challenging, of course, is not eating when you're hungry, or eating when you're not hungry, I should say. When you're out of an appetite, like, I don't know if you've ever experienced this before, for those of you that are not going through treatment now, but if you're not hungry and you know you have to eat something, it can be extremely challenging. And so what I encourage folks to do, especially if they tend to be really busy throughout the day, is to set reminders and just have check-ins, whether it be on their phone or on their tablet or computer, or other reminders throughout the house, like a little Post-it note or something like that. But just set these reminders to kind of check in with yourself throughout the day of how is eating going, right? It doesn't have to necessarily be a angry reminder that you need to eat something, but it could just be a let's check in and see, and you're like, yes, I feel good, I ate something just a little bit ago, or actually I do probably need to have something. Let me see where I have a source of protein in the house that I can just get a little something in. And then the other symptom all the way to the right here with mouth and throat pain can be a really, really challenging one to get through. And again, this is so personalized to the person. And so what I would say is it's a lot of experimentation. So it's really finding the texture and the temperature of foods that work well. I would say I have some patients that do really well with cold foods, and I have some that don't tolerate cold foods well, so it needs to be room temperature. And then I have some people that really do okay with liquids, and then others that do better with kind of softer texture foods like a mashed potato, things like that consistency. So it's, again, something that's really specific to the person. And when you have really severe throat pain, this is where, again, any sort of temporary pain medication that can really help in that moment. I always tell my patients I'm super selfish when I say this, but I would love for patients that have this throat pain to take their pain medications when it's time to eat something, so that way they get the most nutrition in. And that tends to work fairly well. And also just kind of having that mindset of, I need to sort of get through this period of eating while I have this pain. And so some of this pain medication, I know pain medication is very contentious and very challenging for folks to wrap their brains around, given the challenges we have with pain management in our country and broadly. But what I would say is, it is very temporary, and the more that you're able to keep your intake up, the smoother your recovery process will be. We know that folks who are unable to eat for a longer period of time tend to have a longer recovery period, and so a lot of these symptoms may persist longer in folks that are really having a hard time keeping up their nutrition. Okay, so now when we are afraid to eat anything, I'll give you sort of one of my tips for each of these things. So when it comes to nausea and vomiting, I think one of the weirdest pieces of advice that I give that is also extremely important is to avoid your favorite foods when you're feeling nauseous. I can't tell you how many patients have come to me over the years and said, when they're coming for their bone marrow transplant, so they've had some, treatments before, they say, I still can't eat my wife's tomato sauce, or I can't have pizza, or I can't have, whatever it is. And so if there are periods where you are feeling nauseous, leaning on the most boring and bland foods that you would not mind giving away later on will be beneficial. So things that are not super strong in smell or flavor, and avoiding those favorite foods just for the time being is really, really valuable, because that'll keep them sort of on your table, if you will, as life goes on and as you go further and further away from treatment. And also, this is another circumstance where timing the meal with medications is important. Also, what happens for a lot of folks is they won't feel nauseous, so they won't take medication, and then as soon as they get the first smell of food, they'll suddenly be really nauseous, right? And then it's a little bit too late. So what I usually recommend is many of the medications take around 30 minutes or so to absorb into your body and start to affect. And so the best thing to do really is to say, okay, I'm probably going to have lunch, breakfast, a snack in a certain amount of time. So let me take my medication and then let it settle in and then try to eat something. In our hospital, usually takes around an hour for the food to get up to the patient's room from the kitchen. And so when that's happening, I usually tell folks, order your food, call the nurse, have them give you your medication whether you're feeling nauseous or not, and then you'll have the best chance possible of tolerating that meal, right? So the best thing we can do there is to really make sure we're timing it appropriately so you're not having challenges or additional challenges with food that are unforeseen. And then with diarrhea, one of the most important things is that the classical clinical definition of diarrhea is different than what we all might consider diarrhea, right? As soon as our stools get to be a little loose, we're like, oh no, I have diarrhea, right? If it's not formed and normal. Again, the reason I'm glad to have this conversation after lunch, because you've all eaten already and we're not talking about poop right before lunch. But what I think is really important here is hydration, right? Hydration in this world of having loose stools doesn't just mean water, but making sure you're getting in enough electrolytes. So whether this be like an over-the-counter electrolyte solution like Gatorade or any of the other electrolytes that are out there, I always find that my patients like to drink Pedialyte as adults because it's fun and it's like I can pretend I'm a kid again. So if you like the flavor of Pedialyte, by all means, go ahead. And then there's also many packets that are on the market now for oral rehydration. Some of the ones my patients tolerate the best is Drip Drop is one company, and the other one is Element, which is LMNT. They tend to have the best flavor profile, and they're easy to just put into a glass of water or a bottle of water. And those hydration those electrolyte packets can also make the water a little bit more palatable, especially if you're having taste changes where sometimes foods may taste fine, but water tastes gross, right? And you still need to stay hydrated. So how do we do that? Sometimes using those solutions will be useful to really help with keeping that water a little bit more palatable. And then the last one here is with gas and bloating. So just feeling like your belly is full, but not of food, but just of gas. So one of the things is that can happen, especially in your upper abdomen, so right under your chest, is if you're drinking with a straw, you could be inhaling a lot of gas in air. So either carbonated beverages like a seltzer or a soda, or just drinking through a straw in general could be consuming some air, and it might just be getting stuck, right? So that's one thing if you are feeling a lot of that upper abdominal bloating, to say, okay, can I try not using a straw and see if that helps? It sounds very odd, but it does make a difference. And also to eat slowly and chew into small pieces, because again, if you're eating really quickly, you might be inhaling a lot of air and sort of just making more bloating inside of your stomach. And then I think it's really, really useful to bounce these ideas off of either your doctor or a dietitian if you have the chance to see one, to really see what's causing this bloating, right? I can tell you my patients probably get annoyed because when they say they have bloating, I probably ask them 20 more questions, and they're like, I'm just bloated, I don't know how to explain it. And I'm like, that's okay, we're gonna work through that. Because each question really gives more information to really tackle what actually is happening here, and then make decisions accordingly on how to best manage it. And then also just the eating process, right, can be not enjoyable, right? I always try to sort of encourage folks to keep eating as enjoyable as possible and not just make it a survival tactic, right? To really make the eating process as painless as possible. And so when food is tasting different, one strategy, of course, is to try to describe this to someone that can work through it and really try to pinpoint what's causing your taste changes. The other is choosing the opposite taste. So if you're really sensitive to sweet foods, to really lean on more salty, sour, bitter foods to really offset that. And also for a lot of folks, they may just have blunted taste where foods just don't taste like anything. And that's where I would say you can be a lot more heavy-handed on spices and salt and things like that. Especially if you're at home with a loved one, or if you are the loved one and you're doing the cooking for someone that's expressing this, I would say cook normally and then do the kind of super tasting one for the person going through the taste changes, because one of us may taste that and feel like, wow, that's too spicy or that's too salty or what have you, and that finally may be at the threshold where someone can actually taste it. So something may not be palatable to me, but someone that's going through treatment and has a harder time reaching that ability to taste food may just need a little bit of support in that. And the thing that goes hand in hand with those taste changes is dry mouth. And often that's one of the first questions I ask folks when they're telling me that they can't taste anything, is your mouth dry? And they'll say, oh, yeah, actually my mouth is really dry all day. And if you ever think about a time in your life when you've had a drier mouth, whether it be, you have a cold and your nose is clogged and you have a drier mouth, food just doesn't taste good, right? We need that saliva in our mouth to make things taste good. And so keeping yourself hydrated, practicing good oral hygiene, including foods with sauces or liquids, is really important. And I can tell you this is very poignant when people tell me, I can't taste like crackers or bread or a sandwich, but when I drink a smoothie or a soda or what have you, I can taste that, right? So that clearly tells me someone can taste the liquids, but that the solids are more challenging to taste, right? So these can be really useful things, as well as including citrus, as long as there's no mouth pain, because lemon and citrus does pull some of that saliva out of your mouth. And so that can be a helpful, just pretty easy lemon juice on something, either on your food or having like citrus with meals can also just help to pull some of that saliva out. And then I would just say something that I don't think gets talked about enough during treatment is just how mentally taxing it is to go through treatment. So I would encourage just talking through this with someone, whether it be your family members or caregivers, or also talking through it with professionals that are at the cancer center where you're being treated. It's a very, very underutilized resource, and I think it's something that's really important because the mental component of treatment can be a really powerful deterrent for taking care of yourself, right? If you don't have space to really talk through what you're going through and you're trying to really fight through it. So using that space to say, okay, how can I talk this through with folks, right? This is also something where it's sometimes harder depending on where you're getting treatment, but to set up a special area for eating can be really valuable. So when my patients are in the hospital and when they're coming in for their bone marrow transplant and they're in there for a couple of weeks, it can get really boring and repetitive, right? So I encourage them to have a specific area in the room where they have their meals that aren't in the bed, but they're in a specific chair with this table that they set up, and maybe they have a picture they really like or some sort of decoration or something, because then it's at least a special space to eat when you can't actually go to a specific area of your home or apartment or what have you to eat. And I also mentioned that when it comes to music or other media to improve your mood. So this can happen and be useful really when you're trying to engage in movement as well. Folks that are having a hard time with movement, I always say, is there a playlist you really like to listen to, or is there a podcast that you've been wanting to listen to, or a show you've been wanting to watch, or what have you, because sometimes associating eating and or movement with something really positive can be a helpful way to kind of structure those two things together and move the needle forward without having to make it really a challenging process. So to put these together, The first, of course, is that your experience is your own. So it's helpful to talk to others, to learn from others, to read forums, and it can also be really challenging, right? And so just recognize that just because you're not experiencing a symptom or you're experiencing a lot of one symptom does not mean anything is wrong. It just means that's your experience going through treatment. And to be able to recognize that your processing of those symptoms is unique to you. And I've learned that over the years that when I listen to folks, it really has to be based on what they're experiencing and not on what my brain knows about what is to be expected or what other people have gone through as well. I would also just say you're your biggest advocate, and specifically with going through your symptoms and how they're being managed. Clinical teams can only manage what they know is happening. So the more patients aren't sharing about what their nausea feels like, how their stools are for them, et cetera, the less clinicians are going to be able to know how to actually help them, right? So I know it's difficult to advocate for yourself often, and what I definitely do for my patients is I listen and I advocate for them as much as I can, because that's something I can do, right? Is I can go to the doctor and say, this person is still really nauseous, you need to come up with a better plan. And they're like, okay, got it, I'll go talk to them, and I'm like, great. Sounds good. Especially if it affects food, I'm right in there to say, like, let's figure this out. The one meal at a time is definitely something I talk about often, and then I would just say focus on higher calorie, higher protein foods in your smaller, more frequent meals. It doesn't have to be a large meal to be successful. Having a few bites of something that's high in calories and protein can go a long way all throughout the day. Okay, and then the fourth thing is to really protect your relationship with food in your body. Throughout cancer treatment, the way that you eat and the weight that you are, that your body weight can really change, and that can be alarming in a lot of ways. And it can drastically affect how you hold your weight and also how you eat going forward. And so I would say this is really important in the sense of just trying to recognize that eating is just one tool you have in your toolbox to stay healthy throughout treatment. And so all the other things I mentioned, sleep, stress, movement, keeping healthful relationships, et cetera, these are all aspects of healthfulness that can be incorporated to take a little bit of the stress off of eating, especially when it's challenging. And then also note that these symptoms won't last forever. It's really difficult, I think, especially with taste changes and smell changes, to say, like, how long am I really going to have to endure these things, right? And so recognize that that is a part of the process. It's part of this, and you have team members that can help you through it, and recognize that those symptoms will stop at some point, right? None of these things will last forever. And also the gentleness is really important. So being gentle with yourself and your needs. Every day is not going to be the same, and even every few hours is not going to be the same, and that's absolutely okay. And so I would say lean into those moments when you need a little time and space to yourself, and take care of yourself, within a couple hours time span, rather than trying to kind of stay strong the entire time, right? That's very difficult to do. Okay, so I'm gonna switch gears a little bit and just talk a little bit about how your dietary pattern can help with cancer risk reduction and survivorship overall. So there's two organizations that came together, and they put out this report every 10 or so years. This is the World Cancer Research Fund and then the American Institute for Cancer Research. And so they've summarized these recommendations that are actually very similar to the dietary guidelines for Americans, which you've probably heard about over the years. They're the ones that had the pyramid how many years ago, and then it's now morphed into the MyPlate, and it's a more feasible teaching tool, but these are not so dissimilar. And so what I always stress with my patients that either have a history of cancer or are currently going through treatment and are looking to survivorship is that the recommendations I give them are not much different than the recommendations I would give someone without a history of cancer, right? It's not that just because you now have a cancer history that you drastically have to change everything, right? It's not a huge, huge difference. And so the overall ideas here are to include more plant-based foods in general. So what does that look like? That's fruits and vegetables, nuts, seeds, beans, whole grains, and plant oils, specifically olive oils, sunflower oil, avocado oil are better sources, but really any plant oil is going to be better than things like butter, lard, those sorts of things you may include in your diet. And also to really engage in daily movement of some sort. And this is specifically types that are enjoyable to people. So I love sort of hearing from folks what movement looks like for them. That doesn't have to be going to the gym and walking on a treadmill or riding on a bike and you feel like you're just a hamster kind of doing some sort of exercise, right? It's like, what does movement look like, right? So being in New York City, I always feel like movement is walking because you're kind of forced to do that so often, but other folks really find other movement that's enjoyable, whether it be like listening or watching videos at home, yoga, dancing, all different things, anything that involves movement. I have a lot of my like 30-something patients that are just into pickleball now, and so they're like, oh, play pickleball for 10 hours on the weekend. I'm like, great, whatever makes you happy. So just find ways to kind of do movement that's enjoyable and involve others, right? Movement is helpful for anyone, so the more that you can do movement with someone else, it makes it more of a social activity and less of sort of like a task on your list to do. And then again, just listen to your body and be gentle with yourself as you go through that process, because not every day you're going to have all the energy you had the day before or vice versa. So when it comes to limiting foods, again, this is really all based on data that are associative. So there are no strong data, especially in lymphoma, to say this food causes this, right? Every source of media will tell you something different, and they'll tell you to avoid this food because it's dangerous, et cetera. And what I can say is the general philosophy when it comes to cancer is to try to limit the amount of red and processed meat in your diet. So that can be either substituting with more lean meats, like chicken, turkey, poultry in general, eggs, fish and seafood, or plant-based proteins like tofu, beans, things like that. And also trying to limit highly processed foods, so either commercial foods that are sort of in the grocery stores or going out to take out. I will say getting trained as a dietitian and learning how much fat and salt and things are in restaurant foods to make them taste good is really alarming, but it's also very eye-opening because that is why food tastes so good. So fat and salt and things can be really powerful tools to make foods taste better. And then really sugar-sweetened beverages also, that's a big one, especially if folks are having a lot of juice and sodas, which again, I can tell you there are days when I've taken care of patients where all they've had to eat in a day is a couple of ginger ales because their stomach is really bothering them and that's all they can tolerate. And so there are days where that's the reality, but in the general sense, trying to incorporate more waters, seltzers, unsweetened iced teas, things like that into your overall fluid plan can be really useful. The only thing that's really strong connection between risk for many cancers is alcohol. So I really talk about this carefully with patients because alcohol is such a piece of the way that we all socialize in our country. And so really trying to understand with people, what is your pattern with alcohol? Do you have it at all? Do you not have it? And understand what's comfortable for them, right? Because it's really difficult for someone that socializes a lot to then all of a sudden never have alcohol again unless they really are motivated to do that, right? And so talking through that and making it more practical is a really important thing to me as a clinician. And then I would say the other side of that is supplements and vitamins. There are so many out on the market, none of which are regulated by anyone. So really any supplement can have whatever it wants to have in it. And unless someone catches it, they're not going to be able to regulate that. So I usually say to my patients, let's avoid all supplements and vitamins, especially while you're going through treatment, unless it's prescribed by your doctor or recommended by someone like me that's a clinician and sort of saying, I'm observing that you need more of this vitamin, let's get you that to treat a medical need. It's not sort of preventive, just because there's such poor regulation and likely you don't need a lot of the supplements that are out there. And I'm happy to answer more questions about that too. So if you do want to read more about this, this is where the report is located, and it's constantly being updated. And they have specific information about different types of cancer, different risk factors in general, so diet, movement, things like that, and also just overall recommendations, so that like pretty picture that I started this section with is there. And there's actually a really, really interesting and beautiful visualization of how to kind of tap into these resources and a little bit more info. So the more you want to read about this, I think it's a great resource there. Okay, so I'm going to try to quickly go through a couple of diet and cancer myths. And again, I could probably have spent the full hour just talking about this. So I'll give you my sort of like elevator pitch for many of these things you may hear about. And again, if you have questions, I'm happy to talk in the, right after I finish the slides, and then also later on as well if you are wanting to talk about any of this further. So the first is, of course, the very classic sugar feeds cancer question, right? That's the concern a lot of people have. The way I discuss this with a lot of people is that yes, sugar does feed cancer cells, but it also feeds every other cell in your body. Keeps your brain strong, keeps your muscles fueled, keeps your body fueled to be able to make it through the day. So it's impossible for us to avoid all sugar in our diet because almost every food you have except for like butter and oil and things has some sort of sugar in it, right? All of your protein foods, all of your carbohydrate foods will have sugar. The reality about sugar and cancer is it beneficial to limit the amount of sugar-sweetened beverages that you have in your diet? Yes, right? That's the benefit. And much of the data that connects sugar and cancer is due to long-term consumption of a lot of sugar, right? Or in animal models where they can very carefully program that sugar to target certain types of tissue, right? That's where we learn a lot of this information. But the reality is that sugar is such an important fuel for our body in general to stay strong going through treatment that it's impossible to avoid it all, and it's not really necessary, right? So really the message should be to try to limit added sugar as much as possible in the form of sort of desserts and candy and sodas and juices and things, but to recognize that's all within the balance of your overall diet. There's also lots of concerns around dairy, soy, meat with specific types of cancer. And what I will say is a lot of these data are associative data, again, and are not causative data. So it's in individual circumstances. And most of the time, the whole food version of these, especially soy products, is more than safe, right? So having soy in the form of tofu, edamame, even soy sauce is much safer than taking a soy supplement, right? And so that's sort of the overall recommendation is to say, as long as these are consumed in moderation when it comes to your meats and leaning more on lean meats, and same thing with dairy and leaning for the lower fat dairies as much as possible will be a better variety for you. Also, there's a big push for organic fruits and vegetables in cancer risk. I will say the data is not strong enough to support only having organic foods. And it's really not necessary a lot of the time. I would so much rather folks are just eating fruits and vegetables rather than being afraid that they have to have them in an organic variety only. The evidence doesn't show that that's the requirement. And so I would rather someone's getting fruits and vegetables in any form, whether it be fresh, frozen, even canned if they're low sodium, whatever the type is. And the reality is having organic fruits and vegetables, one, is much more expensive, and two, is not always necessary. And so that's something that I think is important to sort of keep in mind. I talked a little bit about supplements, and then I also mentioned earlier on about healthful food choices and cancer risk. So again, in order for your body to be well enough to treat or to fight the cancer while you're going through treatment, your foods do not all have to be healthy, right? Your body needs to be nice and strong, and sometimes that means leaning on foods that are maybe not the most classically healthy foods, right? And so that is something I think is really important to keep in mind when you are having foods that maybe aren't the most healthful, recognizing they have a place in really keeping your body nice and strong while you endure your treatment and while you move forward. Okay, so just to reiterate that key takeaway slide here, we talked about this a bit, and I think is a nice place to sort of end, and I'm happy to take questions, is to really find that balance and that ability to be gentle with yourself and find a dietary pattern throughout treatment that allows you to be the most consistent as possible, and really taking things one meal at a time. I find a lot of patients find that to be liberating because they're not as stressed about what happened earlier on today because now I'm just focused on this one meal, or I have this, odd window of, oh my gosh, I have an appetite for the first time in a while, let me lean into that, right? And I think that's a really important piece. And then just remembering that your health, domains of health are very broad, and you can certainly integrate all these different domains of health into feeling well throughout the day.